My name is Craig Phillips. I'm an orthopedic surgeon who deals primarily in the upper extremity. I've been in practice since 1999. My practice philosophy focuses on treating patients as I would want myself or my family to be treated. I try and spend as much time as I can with the patient to understand their needs and to understand where they're coming from. My philosophy is very much focused on a combined decision making. We both decide what's best for the patient. I'm very conservative in my treatment strategy, and I use surgery as a last resort. The ultimate focus is to get people back functional in a pain-free fashion in the fastest possible time. From my own personal experience, being very active, I play sports, I play golf, I play tennis, and so the weekend warrior syndrome is very common with me. I've torn my Achilles tendon, unfortunately, many years ago, and recovering from that was an eye-opening experience. Treating the people as an entire being and not as an individual body part is important. I've always been passionate about is design. I've designed multiple implants that we use for treating problems, whether it's fractures or whether it's arthritis. Seeing patients come in and being appropriately, adequately and excellently treated in a cost-effective fashion. My rewards are overwhelming when a patient says thank you. Just having somebody say thank you, regardless of what their problem is and how big or small it is. I've been involved with Illinois Bone and Joint for the last 17 years. I came from a big academic hospital where there was a lot of bureaucracy, where the focus was on other things besides orthopedics. And Illinois Bone and Joint offers patients one-stop shopping for all their musculoskeletal needs.